What classes did you take during your undergraduate studies?
I took English and history and speech, A&P 1 and 2, anatomy and physiology 1 and 2. Let's see. Then when I got into hygiene school, we took human embryology, head and neck anatomy. I guess that would be, let's see what else we took. It's been a long time.
Right. Did you?
I went to psychology and
Very cool.
we did take a biology class, one biology class.
Awesome. Can you explain like the process going from like high school to getting your classes done, or I guess like getting into college and then getting into hygiene school?
And the process is when I got out of high school and I decided I worked at a dental office as an assistant for 2 years while I was in high school and fell in love with the profession. The dentist that I worked for encouraged me to become a dental hygienist. So I started, when I got out of high school, by the time I got my application in, it was a little late. So I went to my advisor at the dental hygiene school, and she said what I could do while I was waiting would be take some of my basic classes. So I enrolled as junior college that was close to me, and I took speech and history and A&Ps and the chem, psychology, got all that out of the way, and then I had my application in the very first day it was taken for the following year. And then I was interviewed and accepted and started school the first semester of the next year. And then I already had all my basics already, so I just didn't have to stay at school as long.
Do you have any advice for undergraduate students?
I think sometimes you feel like that you just have to make a great grade so that you can get accepted into whatever your field you're going to want to go into. And you forget that what you learn in your undergrad classes, you will use some of that in your graduate school classes. That's a building block to what you're going to learn in your graduate classes or your whatever school you get into. If you get into a trade school or whatever, you need to take those skills with you. So
Awesome. Where did you go to college?
I went to college at Tarrant County Junior College. I started at NCTC to my basics and then transferred everything over to Tarrant County Junior College. They had a 2-year dental hygiene program there.
Awesome. What does your average day as a dental hygienist look like?
Well, average day for a dental hygienist can differ depending on what you choose and where you choose to work. I've worked in a small town dental office for 25 years, and my day has always started at 8 o'clock. I see a patient every hour until I take my last patient at 4 o'clock in the afternoon, and I work 4.5 days a week.
Awesome. Do you have I guess you can't answer, do you have a most memorable patient? Because patient confidentiality.
I can talk about my patients, I just can't tell you their names.
Okay, do you have like a most memorable patient?
I have many memorable patients. I say probably my most memorable patients are probably my elderly patients. they want you to do a good service for them, but they want you to listen to them, and they want you to almost be a friend to them. A lot of my patients, after I clean their teeth, I give them hugs. I get told that they love me, and I love them back. So you do, after you see patients over and over again, every 6 months for many years, you do get attached to them. So it's healthcare can be very rewarding.
Do you work with any other healthcare professionals besides dental hygienist?
Yes, the dentist in our office and the assistants that I work with are also healthcare. They have licenses now. Assistants do. So, but as far as we don't have any nurses or MDs or anything in our office. Just doctor of dentistry.
Right. Can you name any of the challenges of being in the healthcare field?
I think one of the main challenges of being in the healthcare field is lots of times you're dealing with patients who don't necessarily want to be in your office. So you have to kind of work with them gently and let them know that they're doing the right thing by being there. It's
right.
Good for their health. And sometimes they can be quite unpleasant.
What are the advantages of being in the healthcare field?
I think the advantage of being in the healthcare field is just getting to care about people. I think you have to have a servant's heart to be in the healthcare field. And because some days, you don't even want to be there. But you just go and you just try to do the best service for your patients that you can. And hopefully that you improve their lives.
What is your philosophy on how oral health relates to overall body health?
I think oral health is very important to your body health because toothaches and missing teeth and things like that affect what you eat. And it's very important that a lot of the healthier foods, raw vegetables and fruits like that, you need your teeth in order to eat healthy. And then when we have teeth hurting and when your gums are hurting, you don't eat necessarily the right kind of foods. So, and that helps to keep you healthy.
Do you think you'll still be interested in dentistry in 10 years?
Yes. I've been doing it for almost 26 years. So I think I have 10 more years of being interested in dentistry.
Do you have any experience with like the business or the administrative side of running a dental office?
Yes, I know enough to know that I don't want to be making the decisions about the business. I've been there for 26 years. We have a new dentist, and he does come to me for advice about things because I've been there for so long. But I don't want to be the one that makes the final decision. I just give my advice on things.
Right. Let me rephrase that. What is the craziest or grossest experience that you ever had?
Oh boy.
Or just name a few.
Okay, to name a few. I had a patient that had a toupee on,
Can
and
you
I just it was a
a hair.
piece, and I have to put my arms around the patient like this, and then when I came over to move my section over a little bit, it hit his toupee and it moved it to the side of his head. And he was an elderly gentleman, and he did not realize that his hair was hanging off the side of his head. So I had to figure out what to do. And so I decided not to say anything. And then when I moved my hand back, I just pressed on the toupee and just slid it back over to the right side of his head. And we didn't mention it.
Okay.
And there's many other stories. Do you want to hear another one?
Yes.
I had a very tall, very handsome cowboy in my chair one day, and I had laid an instrument on the top of his bib, and which you're not supposed to do, by the way, but I had just set it there just for a minute, and he like raised up, his phone rang, and he raised up, and the instrument slid all the way down somehow and attached to his very starched jeans right in his crotch area. And I wasn't about to say anything to him about it. So I just went and got another instrument. I finished cleaning his teeth. And then when I raised him up, thankfully, I was a very young hygienist. If I had to do it over with now, I would have said something. I would have told him to remove it. But I was young and I did not. And I raised him up, and when he stood up, it fell to the floor, and he never knew that it was hanging onto his crotch. Very interesting. I have more.
Okay. What is your dental philosophy?
Only brush the ones that you want to keep.
Very nice. What technology do you use, like day to day, in regards to dentistry?
I use my computer,
Okay.
and that's huge. We are paperless. All the dental offices, most everywhere now, are paperless. So I don't have my chart in front of me. I don't write in charts anymore, which I kind of miss that actually. But so we do everything on the computer. We have no charts anymore. I use an ultrasonic along with my hand instruments. When I first started, I just used hand instruments only. I feel like that technology has saved my hand. I feel like that the ultrasonic has allowed me to be a hygienist for almost 26 years. The dentist has laser. I don't use that yet, but that might be in something I might do in the future. But I have to take a class to use the laser, so I might do that at a later date. But he uses the laser up there, so that's pretty cool technology.
Do y'all take any x-rays at the dental office?
I take a ton of x-rays, and that's a good question because we do use digital x-rays, and so now that uses less radiation than the x-rays that I started taking when I was first a hygienist. So the digital x-rays have changed. It's better than it was in the past.
Do you have to continue your education at all?
Yes, we have to take 12 hours every year of continuing education.
Okay, what does that involve?
You have to take 6 hours in a classroom setting, and 6 can be online. And then you get to choose the classes. It just has to be technical, related to the dental field.
What are some examples of classes that you have to take?
Oh goodness, what have I taken lately? I took a class on heart disease. That affects dental health. Heart disease can affect dental health. I took a class on pediatric dentistry, just on how to, better take care of your kids in your practice. I took a class recently on periodontal issues. Nutrition, I like to take nutrition classes. I like to talk to my patients about nutrition sometimes.
So you said you see a patient every hour. So can you kind of run me through how the hour goes by?
Sure. I go up to the front to get my patient, and because it's more personal that way, and bring them back to my room, and we usually chat all the way back to the room. And I have them, as they're sitting, I ask them if they're having any problems with their teeth, and then that answer can be very short or very long. And then, so I kind of assess what I'm going to actually be doing during the hour. Sometimes it's not always just cleaning the patient's teeth. And then we talk about their medical history. And I kind of review what was on there last time, ask them if there's any changes. You can't just ask, is there been any changes in your medical history? Because they're going to say no. You kind of have to go into like, okay, you're taking this and this. Are you still taking those things? Are there any allergies? Have you seen the doctor lately? Because lots of times they'll tell you stuff that they won't tell you if you just ask them, has there been any changes in your medical history? And then I have to make notes on that. And then I will get their blood pressure. And then after that, I will take their x-rays if they need any. Usually I take just a basic series of x-rays. And if they're having any specific tooth problems, then I may have to x-ray a specific tooth. There's different kinds of x-rays. And then I go through process those. I come back and I lean them back, do a oral health screening and just checking for cancers or anything that looks unusual. Just making sure the health is good. And then I go through and kind of check all their teeth for like any problems with any of their fillings or any places underneath their crowns that are having trouble. And then I do a periodontal probing, and I go around and measure from the gum to the bone, and it tells me 1 to 3 millimeters is normal, and if there's anything above that, then I mark that on my chart. Then I start with my ultrasonic, and I start my cleaning, and just clean all the teeth, and then I go back with my hand instruments and check a few areas and do some hand instrumentation as needed, and then I do the polishing, and then I rinse them out really good. We usually chat some more, and then I have the dentist to come in. And they check their teeth, and I make notes of what the dentist says. And then if they need any further appointments, I take them up to the front desk, and we talk to the receptionist, and she gets them scheduled for their next appointments or just maybe for their next checkup. And that's just like a real quick version of an hour with me.
Thank you. There has been a lot of talk about how we put fluoride in the water for dental reasons. Do you have any thoughts about that, whether it's needed or not needed?
Yes, we studied that in hygiene school, and the studies showed that, and I still think that you could do studies today, and the result would be the same. There's still areas in this country that does not have fluoride in their water, and there is more prevalence of cavities in those children than there are in areas where there's fluoride in the water. So I do believe there might be some issues with, there are for sure issues with too much fluoride. That can cause issues with your teeth. So the fluoride actually the water needs to be tested in your area first before you do any supplemental fluoride. And I do believe maybe that there might be some studies that show that fluoride's not good for us. I'm not dismissing that. But I know that children with toothaches is not good either. So I really feel like there's kind of like a balance there that we need to come together on and make sure we have a little bit of fluoride in the water for the kids, because not all children get to come to the dentist. And I see kids that come in with their teeth half rotted out, and they've been in pain since they were little, and it's very disheartening. It's very sad when that could have been avoided with a little fluoride in the water. So, I mean, it could be bad for us, but a little bit of it can help us keep our teeth. So, I kind of see both sides of the coin there.
Awesome. Thank you for talking with us today.
Thank you.